Hello, I'm Charlotte Smith. I'm a lecturer in environmental health sciences, and it's a pleasure to be here to tell you about an exciting undergraduate research project called Mapping the Human Right to Water. The context for this project lies in the fact that almost a billion people globally still do not have access to clean water, and about 2.5 billion people don't have safe and secure sanitation facilities. Almost 1 million infants and young children are still dying every year from diarrheal-related diseases. So to address this problem, the United Nations declared access to safe water and secure sanitation as human rights. 122 countries voted for a resolution that stated the human right to water and sanitation entitles everyone, without discrimination, to water and sanitation that is sufficient, safe, acceptable, physically accessible, and affordable for personal and domestic uses. 40 countries, including the US, abstained from this resolution. So the question is, after the vote, what are countries actually doing so that their citizens can realize the human right to water? So students in our undergraduate research apprentice program undertook a project to answer this question. Each student selected a country based on either their own personal heritage or just an interest in the country. The human right to water, Dr. Leo Heller, to come to Berkeley for 3 days. Dr. Heller gave a public lecture here on campus and met with each student in the project individually to talk about their research, as well as questions that the students might have, and to give the students additional resources. The students had collected evidence from countries' activities from documents that described policies, regulations, or legislation. They also relied on the internet to find out what citizens within countries were doing in terms of their activism and their satisfaction with acquiring the right to water. The students' work culminated in a story map. A story map is a platform which combines maps, graphics, data, videos, images, and is publicly available. Our story map had a section for each country with hot links embedded into the narratives throughout the story map. And these hot links can be used by the user to find the case studies that the students had written, or also links to specific programs, laws, or data that the students found. By utilizing the story map platform, the students' research is available to any country, aid agency, or citizen around the world. For example, a country wanting to create an office within a Ministry of Health specifically aimed at the access to water as a human right can see what another country has done and how they have created that office. Countries and organizations such as the World Health Organization or the World Bank can look at this story map and see the progress of various countries and look at new laws or programs that support this right. Achieving the goal of equitable access is tremendously difficult because each country has its own political or financial challenges, but the data that the students have collected and what they have put together has the potential to help us move forward toward this goal. Thank you.